Hello, everyone, and welcome to our Ventura TV. I'm Sandra Siepak. On today's show, we are welcoming Dr. Lisa Babashoff. She is a breast cancer doctor here in Oxnard, and she is a general surgeon and member of the American Society of Breast Surgeons based here. And we are going to talk to her today about breast cancer awareness and providing more information on breast cancer. Welcome to the show, Dr. Lisa Babashoff.
Thank you. Happy to be here.
Very good. Let's talk about self-exams and mammograms and providing early detection and diagnosis. Should something be found, or should you be concerned about something?
So as far as the self-exam, there is really no age to start with self-exams.
Okay.
You can start in your early 20s and then just get to know your breasts. And each person has different breasts. You know, they have lumpiness to different areas. And usually if someone comes in and they're young and they say, oh, I feel a lump here, but I felt it for 20 years, you know, that's not so suspicious.
Okay.
But if they come here and say, this is a new lump that I found, and even if they're of a young age, it's important to know. Then on the mammogram type of things, there's been some controversy in the last few years over what age to get a mammogram.
Right.
But all of the societies that are focused on this sort of issue state that mammograms should be done once a year,
okay,
starting at age 40 if you don't have any significant risk factors. Mm-hmm. There's patients who have had family mothers mostly that have died at a younger age. And then the standard of care is to start doing your mammogram 10 years prior to the age that your mother died.
Okay, interesting. Yeah, which brings me to the question, should younger women be concerned if there is breast cancer history in their family? Should that be a big concern?
Yeah, for sure. It depends on how old their family members were and how many of their family members they had. If they have a real significant family history, then yes, it's very significant. But what I always tell patients also is that breast cancer most commonly is spontaneous. You know, most of the breast cancer patients come in and they have no family history of breast cancer. So sometimes people come in and say, well, I can't have breast cancer because no one in my family had it. And that's definitely not true. So that's important to know. Okay.
As a surgeon, let's talk about how the importance of early detection really matters. Would it help to have something checked immediately before it gets to the stage where there's something more important happening?
Definitely. As the imaging has gotten better and better over the years, there are things that are picked up at a way earlier stage.
So sometimes fear really holds women back. Sometimes fear and even the cost of having a test done or having something done can really hold somebody back from doing this. What do you say to that?
Well, fear is definitely a big deal. I've seen women who go wait years when they have large tumors. And if they had only come in sooner, we could have certainly dealt with that. There's lots of great therapies these days, and we're learning more and more about how to treat breast cancer appropriately. So it's really important to get in soon, even if you feel something that may or may not be an issue. And then as far as money, there's definitely a lot of free services. October, as you know, is Breast Cancer Awareness Month. Right. And most cities and most towns will offer kind of free mammography in Breast Cancer Month. You just have to look into where to find it.
Okay. Should you receive a cancer diagnosis? I know this really sends people, into a very scared type of feeling. What do you do at that point? Do you have more testing done? Do you go get a second opinion? What do you, as a surgeon, feel the best thing is to do?
Yeah, well, unfortunately, I'm a lot of the times the first person that a patient and their family will see after they've been diagnosed with breast cancer. Surgery is most of the time the first step of what to do after you've been diagnosed, and surgery is almost always indicated in breast cancer. So people come in and they're scared about surgery, they're scared about what to do. And a lot of people or a lot of women come in thinking, oh, I have breast cancer, I have to have a mastectomy.
Yes.
That's not true. You know, the vast majority of times we can perform lumpectomies and save breasts. And that gives a lot of women reassurance too.
Would that also entail having additional things done, such as radiation, chemotherapy, hormone therapy? What else is involved in that?
Yeah, so the big thing is everyone always wants to know, do I need chemotherapy and what stage am I?
Sure.
So usually these days, chemotherapy decisions aren't determined until later. Once I've done surgery, there's tests that can be done on the tumor to determine whether or not that patient would be benefited by undergoing chemotherapy. So when they come in and first see me, I always say the first step is just get the tumor out, you know, and then we'll move on and take it step by step, because there's so much to hear and it's overwhelming your first time that you come in. And then radiation is usually indicated when you've had a lumpectomy. But radiation isn't, some women come in, they know, or they have family that's had radiation in other parts of the body. It's really not that awful for breast surgery.
Okay. It is important, as we mentioned, to not wait, to act swiftly, quickly, and go see your doctor if you do have a question about something. And I know that we did mention that earlier. As a surgeon, is that something that you also talk about with your patients?
Oh, for sure. Yeah. And I emphasize again that when we can pick things up early on, it is such a better result and a better survival rate.
Right. Because I would assume if someone comes into you and they want to wait, maybe that's not such a good idea all the time.
Yeah, sometimes people come in and they have something on their imaging that isn't specific, and then they're asked to wait 4 to 6 months and re-image it. So there are situations where you don't have to rush right into something. But you need a expert opinion as to which way to go. Right.
And also, as far as breast cancer, it doesn't discriminate. I mean, it doesn't matter. I mean, it can go to all age groups, all races. Even men can get breast cancer. Is that true?
Of course. I've had plenty of men over the years that have actually had breast cancer. And yeah, it's a shock and a surprise, and they had no idea they could get it. And then you're right, it's all ages. And I get lots of women who come in and say, I'm healthy, I don't drink, I don't smoke, I exercise every day. Why did this happen to me? So we just don't know all the details, obviously. Yeah.
Do you feel that there's more younger women coming in today?
No. There is definitely a share of younger women that come in, but I don't think it's more frequent in my.
And what is the average age that someone would get a mammogram and then maybe find a lump or something that is concerning? What is there an average age for that?
Well, breast cancer becomes more common as you get older. The information out there is that 1 in 8 women get breast cancer in their lifetime. But that's in their lifetime, so that's taking all comers. So it is more common at an older age, and fortunately, it tends to be more treatable and less aggressive at an older age also.
And what advice do you have for women out there regarding self-exam, mammograms? What is your advice as a surgeon?
Well, as far as self-exams, I think they're important. That if you're doing them and you find something new, definitely get it looked at. But as far if you get to the point where you have a lump that you feel, then you've probably missed a mammogram or two. Because they're very good at finding things at an early stage. So I tell all women, get your mammogram every year. I'm a true believer in that.
Very good. That's good to hear. Well, I want to thank you, Dr. Lisa Babashoff, breast surgeon here in Oxnard, for bringing us more information about breast cancer awareness. And we would like all the women out there to really do self-exam and get a mammogram when it's needed. It really can save your life, and it can really make a difference for you. So
Definitely.
thank you.
Definitely. Thank you for having me.
Very good. And we wish all of you the best of health. And thank you for joining us on today's show. We look forward to seeing you next time. Bye, everyone.